Hello everyone and welcome to another edition of Arkansans Ask. I'm Lance Turner. The State Department of Human Services, it's a massive state agency, Arkansas's biggest, with an $8 billion budget, more than 7,000 employees, and a mandate to provide crucial services to thousands of Arkansans. That includes the poor, the elderly, the disabled, and those whose family is in crisis. The department also oversees Arkansas's hybrid Medicaid expansion program, now called Arkansas Works, which provides health insurance to more than 290,000 Arkansans. There's also the Our Kids First health insurance program for children, the Supplemental Nutritional Assistance Program, or SNAP, and services for adopted and foster children. Tonight, we're joined by 5 of the agency's top leaders. Cindy Gillespie, the Director of the Department of Human Services, Kelley Linck, Chief of Legislative and Intergovernmental Affairs, Mark White, Deputy Director of DHS, Mary Franklin, Director of the DHS Division of County Operations, and Misha Martin, Director of the DHS Division of Children and Family Services. With the help of our phone volunteers here in the studio, these experts and decision makers will be taking your questions about DHS, its services, and its operations. This program is for you and driven by your questions, which you can submit by phone at 1-800-662-2386, by email at paffairs@aetn.org, and through Twitter using the hashtag ARAsk. To everyone on the panel, thanks for joining us tonight. We've got a lot of ground to cover, as we've said, and as you all well know, this is a massive state agency that has a lot of moving parts, so we could talk for hours about all these subjects. But first I want to kind of go through and just let each of you sort of lay out what it is that you do and sort of a brief history that you have with the organization. And we'll start with the new director, Cindy Gillespie.
Thank you, Lance. Delighted to be here. And I am the new director. I started in March of this year, so I've only been here about 4.5 months. It's a new venture for me, and I'm also a new Arkansan, and thrilled to be here.
Welcome to the state.
Delighted to be here. In my role as director, largely what I'm doing is overseeing really the strategic direction at this point of the department. We are doing a great deal of work to take a hard look at the way the department delivers services and the way we're organized and the way we're arranged. So I work with an incredible executive team there, half of whom are with me tonight, right. And we are basically in charge of managing and delivering all those services, both effectively as well as cost effectively.
All right. Kelley?
Well, Lance, I'm the Chief of Legislative and Intergovernmental Affairs, which is sort of a new position that Director Gillespie has brought in with us. Up until just probably 2 months ago, I was a legislator.
Right.
And I've left behind my 134 colleagues and good friends to come join the team at Department of Human Services, where I can open up that pipeline of communication to help the legislators better understand what can be a confusing agency, right, looking from the outside in. We want to be sure that they can make good and fair decisions, and we want to make sure they can get that information. And likewise, we want to make sure that the agency directors and the other chiefs can get a good feel for where the legislature is at and the decisions they're trying to make, and then help each other get the information they need to have the best government we can and the best agency we can provide.
Right. Mark?
I'm one of the 2 deputy directors for the department, and so I oversee our divisions that relate to health care. That includes the Arkansas Medicaid program, as well as the several institutions we run. People don't always realize that DHS is not just a bureaucracy, we are a health care provider. And so we run the Arkansas State Hospital, which is our state's only state-run psychiatric hospital. We have the Arkansas Health Center, which is a nursing facility that's in near Benton. We also have 5 human development centers where we serve the developmentally disabled. And then we also provide services to senior citizens throughout the state through our divisions.
Mary, you are a veteran of this agency.
Yes, 24 years next month.
Congratulations.
Thank you, thank you. I love what I do, and I believe in what the department does. I'm the director of the Division of County Operations. We are the division, I refer to us a lot as the gateway to human services. We have offices in all 75 counties. We administer the Supplemental Nutrition Assistance Program, the SNAP program. We also determine eligibility for the Medicaid program and the new Arkansas Works program. We also do transitional employment assistance, and through our Office of Community Services, we also provide assistance with low-income home energy assistance, with emergency solutions grants for people who are homeless or at risk of being homeless, as well as USDA commodities and community services block grants, which basically fund activities to help build families and communities. So we do a lot.
Yes, you do.
We also help people connect with the other services inside the department. If they need assistance with children and family services or aging or developmental disabilities, we just connect them to the right people who can help take care of their needs.
Misha?
Yes, I'm Misha Martin. I'm the new director of the Division of Children and Family Services. I became the interim director in April, and just in the last few weeks was named as the permanent director. Prior to being at DCFS, I was at the Office of Chief Counsel with DHS as an attorney representing the division. So I've been working in the child welfare system for the last 8 years. So at our division, we are in charge of helping and caring for the over 5,000 children that are in the state's custody in foster care. We also have in-home service cases where we help families in crisis, and we finalize adoption. So we work with adoptive families to create forever families, and that's what we do at the division.
All right. An array, as you can see, of services that you are responsible for, and also people who are not on the couch and working back at DHS offices. Cindy, I want to talk to you a little bit as we kind of get things going. You were hired by the governor earlier this year, as you said, to lead DHS, and you started work on March 1st. What has the governor said to you about the challenges that the agency faces and some of the outcomes that he would like to see?
When I interviewed with the governor, I asked him exactly that, and he told me a couple of things that he wanted to make sure well, two things in particular he wanted to make sure I focused on. One was the long-term sustainability of all the health programs, not just what would become Arkansas Works, but all of the Medicaid programs and the other health programs. To make sure that what we were doing was going to be financially sustainable, so that we didn't have a situation down the road where people who needed health services found that they couldn't get them. And the second area was to focus on child welfare and to focus on the foster care issues and what was going on with that system. Concerned very much that we have a system that protects children. So those were two of several areas that he mentioned to me, along with a need to take a look at the accountability of the department and the structure of the department, and whether or not we were efficiently delivering services. And one piece of that, interestingly enough, in the conversations was, which was kind of, it really hit me when I finally came in the door, was he asked me about contracts. And how would you, one of the questions he asked me was, how would you keep an eye on this agency does contracts that are worth hundreds of millions of dollars. So how do you keep an eye on contracts when you have an $8 billion agency and you have so many thousands of contracts flowing through it, and so many of them are worth so much money? So how do you make sure that we're spending the money properly? And it turned out to be a very insightful question, I learned, when I came into the department and started asking that question. Right.
And so what have you learned about it? How do you answer that question? Or are you still finding the answer for it?
Well, and they're smiling over here because they know what happened. I came into the department, and the department is organized with 10 different divisions. And so, as you heard from some of the divisions, but there's also a division that oversees behavioral health, one that oversees developmental disabilities, one that oversees services for the blind, one that oversees Division of Youth Services, which is our correctional services for youth. So, very broad department. And I came in and said, all right, let me meet with the folks who are in charge of contracts. And the answer was, which contracts? I'm like, well, what's the structure here at DHS for contracts? Depends on which division you're talking about. Each division does their own contracts. Oh, okay. And then that question kept going. I'd like to meet with HR, talk about personnel, hiring. How are we doing this? Depends on which division you want to talk to.
Right.
Everybody does their own. And what I learned very quickly, and we decided to institute a 60-day review of the business operations of DHS, came from that. Each division was set up as its own individual silo, and they each did all the same business functions.
A lot of duplication.
A lot
among
of
all those
duplication.
different areas.
And, you know, we found when we began to look at it and pull it together, we found that, you know, several divisions might be buying the exact same thing. They might even be buying it from the exact same vendor, but they'd be paying a different price.
Wow.
We found that the process of reviewing that purchasing and that contracts didn't go very high up. We found that personnel and hiring, even though we've got very good people in the department, our employees are one of our greatest strengths, we found that the personnel and hiring process was completely different from division to division. And that in every area, IT was another area. We found that each division did their own technology. They did their own IT. So we found we had hundreds of different systems, some ancient, going back to Lotus, because that division, sitting as a silo, couldn't afford to update their computer systems, while another division might have the money to update theirs. So very much a siloed organization where we really didn't have, we really hadn't bought, frankly, we had not bought the buying power of an $8 billion organization together to go out and get effective purchasing for the taxpayers.
So this was a review of the business side of the house, as it were, and you've instituted kind of a shared services system now.
We have.
The next step is perhaps more daunting and seems as if it will take more time, and that is the reorganization of the services side. So where are you in that process?
We've started taking a look at two areas. First is how we're delivering services to the clients, and we're trying to go at this from a frankly, from a client-centered viewpoint. When you think about, as Mary was talking about a few minutes ago, when you think about someone who comes into our county offices or someone who's in need of our services, how do we make sure that all the services that are available are easily brought to that person? How do we make sure whether, and we see this across every different area, when we look at a foster child, when we look at a family, how is that handled? How siloed is it? How easy is it for that person to access, for them to access services and get what they need? Even areas like providers. We had a discussion today because we've begun a review of how many different divisions are auditing the exact same provider.
Wow.
So how many times do they have an audit team show up when one audit team could go out at one time, get all the information, and then if there needs to be a follow-up, that could take place. So it will take longer, but we are going at it from that standpoint of figuring out who are the people we serve and who are our partners that help us serve them, and then literally pulling the divisions together to figure out who all is involved in this and how would we bring our operations together. So that's the first piece of this. Simultaneously, because it's an important part of it, we're looking at personnel. Who are the people we have delivering services? How should we be organized, not just in personnel, but how should we be hiring? How should we be paying people? How should we be incenting good performance? Frankly, how are we working customer service into our evaluation of how we're delivering services? So that is also a very comprehensive look that we're taking. And while we won't complete all of this, we've got ourselves running as fast as we can with the idea that we will want to take to the legislature, to the governor first, and with his sign-off and approval, then to the legislature, some changes to the department so that we can more effectively deliver our services.
You did mention personnel, and we do have a question about personnel from a viewer who wants to know, given all the changes in the last couple of years and all the turnover in key positions, how do you retain good help with such a low salary structure and not the avenues necessarily all the time to pay in perhaps in a more competitive way that you might like?
That is an excellent question, and it is a huge problem for us. We, just to give you a very straightforward example of this, we are looking at right now a department. We have about 7,500 people. As Mark mentioned, about half of those actually work at our provider institutions. They actually work at the HDCs, at our hospital, at our nursing home. All right? So about 3,000 of our people are over there doing that. hiring nurses in this market, extraordinarily hard.
Yes.
Extraordinarily hard for us to compete. We have a 22% turnover DHS-wide.
Wow.
Think about that. Almost a quarter of our people leave in a year. Just the training costs, just the loss of knowledge annually. And then if you go into some of our divisions, we actually have in some of them 30, 40, almost, we have some offices where there's 50% turnover in a year. Retraining and trying to get things going not only is a loss of time, but it's a huge cost to all of us. So, that's how we're going to retain people, is through an effort. We haven't got all the details worked out, but what we are going to do is we're looking at pay scales. We're looking at whether or not it's possible for us to do incentive bonuses. We're looking at how we begin to align with some of the colleges and universities to be able to create a more direct track in for us, so that we can pull in workers more directly and get them working with us. And frankly, the other thing is we've been doing exit interviews and learning from our employees that sometimes it's not just the pay. I mean, when you talk to social workers, many social workers go into this line of work not expecting a large pay, right? But the stress of the job, the hours we have them work, the overtime a lot of our people work. And frankly, because they're working, somebody who gets a few years of experience finds himself getting heavier and heavier and heavier caseloads because more and more people are either turning over or inexperienced. We have to do a lot to address both the work environment as well as elements around pay structure.
Right. Another question here from a caller in Hempstead County. This person says their daughter had her Our Kids application duplicated, and she has been told there is no one she can speak to about it. And basically this person is wondering what they can do about that. And Mary, I think that maybe fall under some of your purview.
Yes, it is a problem that we have had in getting our new system developed. There, if we end up with maybe people applying a second time because they hadn't heard from us as timely as we would normally be able to do work, and it creates a duplicate in the system, and it does require manual work, additional manual work to get those duplicates merged so that the system can process the eligibility. And sometimes we have to send them even outside of caseworker capability to our systems unit and system developers to get those cases fixed. And we have a lot of casework at this point that we are working very hard to complete and catch up. And we have a goal to have that done by the end of the year. And so that under normal circumstances, when we don't have that backlog, in addition to working through some challenges we're having with our system, we should be able to be much more responsive and much more timely in resolving these kinds of issues for our citizens and our clients. What I would advise this caller to do is we do have a toll-free call center.
Okay.
And I'll be glad to provide that 800 number. It is 855-372-1084.
Okay.
And the call center hours are from 7 a.m. to 7 p.m. because we're trying to be more available outside of normal working hours so that people who do need to reach us before 8 o'clock or after 4:30 can still reach us. In addition to that, you are welcome to contact your county office directly in the county where you live, or really any county office. And a list of our county offices is also on our website at www.dhs.arkansas.gov/DHS.
Okay.
So if you reach out to us either directly to your county or through the 800 number, we will be able to tell you what the status of the case is.
Okay.
And just know that we are working as diligently and as quickly as we can to get these issues resolved so that people don't have to wait longer than they should.
And we should note too that we're keeping track of these questions. These questions will be forwarded to DHS offices for further follow-up as well. But then also you can call those numbers and get that service that you might need. Cindy.
Lance, if I could just give a thank you for a moment to the governor and the legislature. What Mary was referencing there, I guess about 3 months ago, shortly after I got here, we tried to pull together a good hard look at what this backlog of casework was,
right,
and found out that we had over 100,000 cases that were needing work, but not the people to get that work done.
Right.
And we went to the governor and asked him to approve a plan for us to bring in temporary resources between now and the end of the year, contract literally with a company, and do that in order to clear away this backlog. Because the other choice would be to spend another couple of years with people waiting to get through these kinds of problems, and that's just not acceptable. The governor blessed this plan. We took it to the legislature. They approved the contracts and the funding. I mean, this was done very rapidly, very quickly, and we launched a month ago, and the company now has completed training, and next week they start working side by side with various people.
It could be today or it could be next week that they will be working on that.
They will be, and we went through the final reviews today. Everything's live to go, and we will be providing monthly reports to the governor and the legislature as we get through the rest of that case log. And as Mary said, we plan to be done by the end of the year, and people should begin to see things moving much more effectively.
Yes, absolutely.
Mark, this could be a good time to give kind of an overview of certain services that DHS provides. This is from a caller in Grant County. Are there any services that help pay for the services for children with disabilities? And I'm sure there are an array of those that you can offer.
There are an array of services. Of course, we have the Medicaid program as well as Our Kids First, which provides health care for children throughout the state. In addition, we have what's known as the TEFRA waiver, which is a program that's specifically designed to help children with disabilities. And it's designed so that even if parents may be working, may have some income that might otherwise exclude them from Medicaid eligibility, we know that in some cases, if you have a child with a severe disability, even with a good, steady job, you cannot afford to pay for your child's care that is needed. So we have that program that's available to help children in those situations. So certainly anyone who has a child that has that type of disability, who needs those type of services, we encourage them to call our county offices and let us talk with them, see what programs may be available so we can provide them assistance to get their child the care that they need.
Moving sort of through a person's life, when a disabled person, it's time for them to go to work. What services, this is another question, how does DHS help individuals with disabilities become employed?
We have a wide variety of programs to help individuals with disabilities. Of course, we have those who have developmental disabilities, and we have a number of programs available, and we're working to expand the opportunities to provide employment opportunities for those individuals. We also have programs for adults with physical disabilities, so that we can provide them the adaptations they need so they can get in the workforce and they can be productive and do work. And of course, just having access to health care is a key necessity for individuals to work. If you're sick, if you have a chronic condition that requires medication, if you can't get access to that care, that can very often keep you from working. So that's been one of the successes of our Healthcare Independence Program, soon to be Arkansas Works, as of January 1, that individuals who in the past could not obtain that kind of care for their chronic conditions now can, and it enables them to go back to work.
Another one from Mark or Sidney, a caller from Pulaski County. What are the plans to deal with indigent and mentally ill in Arkansas, with the indigent and mentally ill in Arkansas? Arkansas, this person says, is 50th in delivery of services to the mentally ill. That's a challenge that the state faces as a whole. How is DHS equipped or planning to deal with that problem?
It is a real challenge, and when you look at our behavioral health system in the state, one of our biggest weaknesses is we have a great amount of services that are available at the very top of the spectrum. Residential psychiatric care, things that are very expensive but are necessary for very serious illnesses. We also have a good supply of services at the bottom of the scale. Your ordinary therapy, things like that, medication. What we're missing are services in the middle, where you need more than just an occasional medication or occasional therapy. You need some help, but at the same time, we don't want you to have to go into a residential facility or an institution. We want you to be able to stay in the community, to continue working, to be at home. And so we are working with the legislature to develop some plans to expand the availability of those services. And in doing so, we think that's going to generate some significant savings for the taxpayers, because right now we have too many individuals that are going to those high-cost types of treatment that we think can be served in much more efficient, much more effective ways. And so that's something that the Healthcare Reform Task Force, the legislature, has been working on. They've had multiple hearings over the last year, and we're closing on some plans with that task force to help generate some savings, but also to generate a better array of services for individuals.
And again, is that something, like you said, you alluded to the General Assembly, is that something we can look forward to perhaps in this coming session, or do we know, is there a lot of work yet to be done, so we don't know?
I think there'll be two parts. You'll be seeing this fall, we're going to bring forward a set of rules changes, changes to our manuals and our programs that the legislature will review. And then I expect there will be legislation in the next session as well. So it's going to be a continuing effort over the next 6 to 12 months.
All right. We invite you to keep your questions coming. We've got a fair amount here that are already coming in, so I think we've got a hit here. But if you need to call 1-800-662-2386. You can also email us at paffairs@aetn.org. And if you're on Twitter, you can reach us at the hashtag #ARAsk. Here's another question from a relatively new DHS staffer who is based in Fayetteville, new employee. This person says there is currently no ombudsman in any state agency here in Arkansas, even though they are effective in terms of conflict resolution, process involvement, other workplace situations. Given the ongoing reorganization at DHS and the recent hire of Patricia Nation as deputy counsel, is DHS open to the idea of appointing an ombudsman to complement the formal grievance and complaint processes already in place? Sydney, that sounds like a Cindy question.
I can start that, and then I'm going to turn it over to Mark, because he's obviously been here a lot longer. I mean, part of our thinking in asking Patricia Nation to take the role over within the employee grievance area was to put in that department someone who is known for her years of service in the area of civil rights and her focus on client advocacy. When we moved Patricia over and asked her to take this new role, she had been till that time a client ombudsman. And so now she's over in this role, and she is really looking at it from that standpoint of ensuring that the employee grievance process is fair and that there is a vehicle for employees to reach out. And so one of the things we tried to do as we moved Patricia over was to I sent a little note out to all the employees telling them about her and encouraging them to be aware that she's there and that they should feel free to reach out to her. As we go through this process, the other thing we are going to be doing is ensuring that we have some active efforts for our employees to give us input in what we're learning, both in ways where they are talking with us, communicating with us, giving us their ideas, their input, reactions to proposals, frankly, where we know who is doing it, but also where we conduct surveys that are anonymous, and so that there is a way for employees to give us feedback without actually themselves having to identify that this is them, and they can feel free to give us good input. Mark, you've obviously worked in that field a lot longer.
I have. Before I was a deputy director, I was the chief counsel for the agency, and one of the offices that was in my office was our Office of Employee Relations, which handles grievances that are filed by our employees. And like other agencies in the state government, we have a grievance process so that if an employee feels that they've been wronged, they've been treated unfairly, they can pursue that grievance and have that heard by an impartial observer, someone from outside their chain of command, and get a fair decision on that. But we recognize that one thing that was missing is we have that grievance process that is there after there's already been something significant that's happened. Either there's been some discipline or there's been something that's happened between that supervisor and that employee. And what was missing was an effort to try and address some of these conflicts before they reach that stage. So we have been working on some ideas to provide some conflict resolution training to some employees who can work across the agency And when there is a situation that's brewing that may result in a problem, we can bring someone in and work between that supervisor and that employee to hopefully resolve that situation before it gets to the point of being some sort of formal employment action or being a grievance.
All right. We have another question from a viewer, caller in St. Francis County. This is regarding youth and or child services. Okay. So, Misha, this one would be for you. This person wants to know, do I have to go to court to receive custody of my niece because the biological mother has lost her place of residence? And there's probably a lot of factors here we obviously don't know, obviously.
Right. I'm sure there are, but I can give a very generic answer. That is, anytime true legal custody is changed from one person to another, it does take a court order. So many times relatives may allow their kids to stay with other relatives or to stay with other individuals, and they may, sign powers of attorneys, or they may just say, you can keep my child for a while. That's acceptable, but true custody is only changed through a court order.
Mm-hmm. And we should say we've actually got a graphic with some contact information that we can show if you have further questions beyond this show and you wish to contact DHS. We've got a graphic here that will tell you exactly where to call, who to call, and perhaps even what email address they can contact you. And maybe we're having trouble mustering that graphic right now, so we will show that here in just a moment. But we have other avenues as well for folks who need to get further information about DHS and specific questions that they may have. Here's another question from Mary. This person in Pulaski County said they received SNAP while unemployed, the food stamp program, supplemental nutritional program, started school at a community college and then lost the benefits. And this person wants to know why they could not get an answer from their county officer.
Okay.
And maybe what the answer should be as well.
There is policy related to the SNAP program about being a full-time student in higher education. And SNAP is a federal program with federal guidelines that it's our job to implement. And one of these guidelines is if you are in higher education and you do not meet certain exceptions or exemptions, that you are not eligible to receive SNAP benefits. And some of those exemptions would be if the person was disabled or considered aged, or if the person was working at 20 hours a week or involved in vocational rehab or job training through Workforce Investment Opportunity Act. Or participating in the SNAP Employment and Training Program. Those would be exceptions. But if a person was college work study also. So if a college student is not meeting one of those exceptions and they are at least a half-time student in higher education, the rules say that that person is not eligible for the SNAP program.
Another person from Cleburne County is wondering whether you count grandparents or guardian income to set our kids' insurance for that child, for those recipients.
Typically, the answer to that question is no. If you're a grandparent or aunt or uncle that is raising a grandchild or niece or nephew, then your income is not factored into the eligibility determination for Medicaid, our kids.
Misha, back to you, dealing with issues of children and families. Of course, that's brought a lot of spotlight to the agency and the challenges it faces there. This person don't know where this person is from, but this person has called in and wants to know what do we do if we know there are children living in an abusive and dangerous environment, and they've been told that their hands are tied? What if you know of a bad situation? What should you do?
The first thing you should do is you should call the Child Abuse Hotline and make a report. And the Child Abuse Hotline is run by the state police, and we can get that number. And you can call the hotline, but if you believe that the child's in immediate danger and needs to be assessed immediately, please call your local law enforcement. The Child Abuse Hotline will accept the call, and depending on the level of abuse, either DHS or state police will initiate the investigation within 24 to 72 hours. So if there is some immediate crisis that's happening, you need to call local law enforcement and then also call the hotline.
All right. We have another question here from DeShay County. This is dealing with foster children, I believe. How can we better protect the children's privacy? The Heart Gallery So this is dealing with the Hart Gallery and foster children. How can we better protect the children's privacy? Anyone can see pictures of the foster children on the Hart Gallery website, as well as all ages. Is this infringing on their privacy? Can there be more security on the Hart Gallery website? This is, and I'm not familiar with the Hart Gallery, so we may need to know what that is.
I can explain that.
Okay.
I can explain. The Hart Gallery is, it's two things actually. It's a website that has photos of our children who are eligible for adoption, and then there's actually a Hart Gallery where there's pictures, physical pictures that travel around the state so that people are aware of the children that are available for adoption. Federal law actually allows us to do some promotion for those children who are available for adoption, because we don't want our kids to live in foster care forever. We want them to find a forever family. So only the children that are available for adoption are featured publicly, and it is for a very specific, targeted group of individuals that see that. And I understand the concerns. You know, I've heard those before. You know, we want to be very respectful for all of our children who are in foster care and their privacy and what they've been through. So even if a child is identified, say you see the picture in the Hart Gallery and you think, my wife and I might be interested in adopting that child. You call us and tell us about that particular child. We don't immediately disclose everything about that child. We're very protective of the child's information and take you very slowly through the process before we start disclosing additional confidential information about that child. So we do try and balance between making sure our kids don't languish in foster care and we find them those forever families, but we have to also balance and make sure that their information is confidential.
Has that been an effective program for you?
Absolutely. You know, our adoption specialists, I think, do an amazing job across the state trying to find forever families for our children. But we also have a great partner in this, Project Zero, who is a nonprofit organization that was developed to specifically find adoptive homes for our children who have been difficult to find forever families, and they have some amazing success stories.
We have the graphic now, so if you do have specific needs that you need to address directly with DHS, the Department of Human Services, you can go to the website, humanservices.arkansas.gov. You can call their phone number, 682-1001. There's a toll-free number there as well, and you can also dial 711 for Arkansas Relay Service. So if you need to contact DHS directly for any reason, those are the places you can do it. You can also call us with your questions. We're taking your questions right now via several avenues. One is phone, 1-800-662-2386. We're also taking your emails at paffairs@aetn.org, and we're taking questions on Twitter at the hashtag #ARAsk. We've got another question here that's, I think, is a common complaint or misperception or legitimate issue about people who, quote, milk the system of benefits. How big an issue is it that people are, quote, milking the system, and what safeguards are in place to mitigate against that?
I'd be glad to take that. I was kind of enjoying the show, Lance, but I guess
we need to hear from Kelley Linck.
I've been doing a heck of a job over here. I've been learning a lot.
Yeah.
I had no idea about the college thing, and so
fantastic.
So the legislature was concerned about that as well. When I served in the legislature, I served as chair of the health committee, and some of this came through my committee. And because that would put in the office of the Inspector General, Medicaid Inspector General, and that is one of the safeguards of looking to see if people are milking the system, is using that terminology, or perhaps even vendors, or that being medical care facilities, are overcharging Medicare and Medicaid. Within the Department of Human Services, we have our own department that looks for that as well. We don't just depend on someone else to look for that, but we look for that as well. And so there's at least 2 safeguards out there that the public has to try to make sure that the system's being protected, their tax dollars are being protected, and we're keeping the honest people honest.
All right. We have a question here, another question here from Mark. This is about developmental disability. This person is on a waiting list to get their son to get Medicaid. This is a person from Arkadelphia. What is the state of that developmental disabilities waiting list. And that's been an issue that we've been dealing with for a while.
Right, and you hear people talk about the DDS waiver is what's referred to, and the formal known as the Alternative Community Services Waiver. And what that is that's a program that allows us to provide services to individuals with developmental disabilities so that they can remain at home or in the community and not have to be in an institution. Because of the limited funding, we have a limit on the number of individuals who are in that program. So right now we serve about 4,000 individuals around the state as part of that program. We have another 3,000 who are on waiting list, and it is a very long waiting list. I think the person who is at number 1 right now has been on that waiting list for more than 8 years. And so that is a very serious concern for us. Ultimately, there's two solutions to that. Number 1 is there simply has to be more state funding dedicated to address that waiting list. Now, there is federal funds that are available, but we have to have state funds to match those federal funds. And it can be very expensive. So right now we spend an average, it's about $50,000 per person to serve someone on that list. So it's very expensive, but it's also very necessary, because the alternative for many of these individuals is to be in an institution. And that is, number 1, that's much more expensive, but number 2, if they want to be in the community, that is not fair to that individual to force them to be in an institution. So there is a need for more funding, but we're also looking at other ways that we can improve our program, be more efficient in the program, so that we're ensuring we're delivering the right services to these individuals, so that perhaps we can serve more individuals under that program.
Kelley, we had a couple of different proposals that were aiming to deal with that waiting list during the legislature this last time. Some of it sort of got woven into the managed care debate that we had in the legislature. Do we expect more runs at this problem in this session?
The legislators I've talked with consider this a very serious issue. They're all searching for the same answers that we're searching for, is the funding to carry that out. And there is concern that if the waiting list is only 4,000, or other people out there that just haven't applied because there's no choice. We call that the phantom waiting list. So before you go find the funding, you got to know exactly how much you need. We're not even sure of that, of what we need. But it is a serious concern in the legislature and the governor's office as well. So I suspect that we will see some proposals, and you know, that's not a guarantee of an answer, but we'll see some proposals to consider.
Here's another question, possibly for Mary. Are there any programs to improve the home in a rural community for a person with a disability who is on SSI and Medicaid? Home improvements for those people.
Home improvements. Typically that would be the weatherization program, which is funded through the LIHEAP dollars, low income home energy assistance, and actually the Arkansas Energy Office administers that program now and can provide more detailed information about the application process and how that works. But we do have a program that works on those things.
And then I'll mention we also have our AR Choices program, which provides services for adults with physical disabilities and also for the frail elderly. And there are benefits available through that to help with home modifications. Again, to help an individual remain in their home and not have to go into a nursing home or another institution, because again, that's a lower quality of life for that individual in many cases. It also is much more expensive for the taxpayers.
Right. Misha, this is a question dealing with sort of the timeline and the process for dealing with a child abuse claim. When a viewer wants to know, when you file a child abuse case, how long typically does it take to receive results? And again, these can vary wildly.
Yeah, that's a very complicated question. So, you know, once you call the child abuse hotline, like I talked about earlier, the initiation is within 24 to 72 hours, depending on the type of allegation that's made to the hotline. And DCFS or CACD will come out to the house, and DCFS assesses for safety. So Division of Children and Family Service goes to the home, sees the child, assesses for safety. If there is a safety issue and the child needs to come into foster care, then that begins the foster care process. And every child that is brought into foster care has a court case, which spurs a court case. If the family is just in need of services, then we can begin to provide services, and we call those in-home cases. And depending on whether you have an in-home case or whether the child ultimately comes into foster care, that can determine the length of time.
Here's another case related to foster care. This is an email question. Why do children who are in foster care who move from foster care to temporary custody of a relative lose their Medicaid services, including medical care, SNAP, and other services, causing that relative to have to reapply for those services? Is that a thing that happens, and why does that happen?
That is, and I'd like to back up from that question as well. So we at the division have really been, we have been encouraging relatives to become provisional foster parents. So when a child comes into foster care, we are going out there and we are really talking with those relatives and saying, do you want to be a provisional foster parent, or do you want to have temporary custody? And when we talk to families, we should be encouraging them about what benefits come with the child remaining in foster care and then becoming a provisional foster parent. Because when a child is in foster care, the federal government allows us to have those children, the majority of our children are eligible for foster care Medicaid. So when a child is in DHS custody, they're eligible for Medicaid. But once we give that child in temporary custody, the court signs an order and gives to the relative, they're no longer in our custody and not eligible for that foster care Medicaid, and their Medicaid eligibility would be based on those relatives. It would be, based on their income or whatever the other circumstances are. Mary could probably talk about that better than me. But so we really want relatives at that first stage to consider if you need services, if you need Medicaid services, any additional services from DHS, please strongly consider being a provisional foster home. You open your home just through a background check and an in-home consultation, and then your child can be placed very quickly in your home.
In terms of the foster care program as a whole, it's been a focus of what the governor's attention and really statewide attention in the last couple of years. And the governor has called for faith-based institutions to get involved, really anybody to come in and be a part of that system. What is your assessment of those efforts so far? How successful are we in getting more people, more volunteers, more foster parents into the system to help kind of relieve the burden that this program has experienced?
What I've seen since I got here is that the efforts that started up are definitely bearing fruit. They have opened, Misha can provide more details on this, but we are seeing a lot more foster homes. Some of the partners that are working with us from the faith-based community have been amazing in putting together focused efforts to recruit foster homes and to work with us on that. So we are seeing those efforts pay off, definitely. Inside the department, part of what we've done for the last, I guess, 3 months is to have an intensive effort that we've sort of begun calling internally Foster Care War Room, where all the divisions of DHS have come together 3 times a week to spend a couple of hours, a couple of hours 3 times a week, in sessions to really do a deep dive around what is going on with foster care, around the recruitment of foster families, around children in our system, and services to families, how we're doing everything, and to figure out how we all wrap around that system. We internally now what we talk about is that these are the DHS children. These are not the DCFS children. And I know everyone sitting here has been part of those ongoing meetings, and we're finding a lot of areas where we can, as a department, step up and do a good bit more to help make that system stronger. And a piece of that is that we have created our new part of our reorganization was to create an Office of Communications and Community Engagement. And within that office, we are going to have a director of faith-based and nonprofit support, someone who can actually be on point ensuring that both for DCFS as well as throughout the organization, we're actively working with those partners and really drawing on them. I think we will have an announcement in the next day or two of who is taking that position, and we're very, very excited about that. We know this is a central point for us, is we don't do this alone. We have to do this with partners, not just with DCFS and with child welfare, but we have to do it across the organization, really working with the partners out there. Misha, you've been involved in all those activities for the last year. Do you want to expand on it?
Sure. Well, I thank Ms. Gillespie, who allowed me to do some reorganization of central office DCFS very quickly after I was named interim, and to put a focus on placements and community outreach. So our division is now organized where we are focused on connecting with our faith-based organization and our other nonprofit organizations who want to partner with us, so that they are able to communicate more effectively with us. And I'll tell you, some of our faith-based, like I know a lot of people have heard about the Call, Children for Kids, ABC Families, Homes. They're all out there recruiting foster homes for us, and they have recruited more foster homes than we've actually recruited. So over 51% of our foster homes are recruited by our partners. I was excited to learn just yesterday that in the last 30 days, we opened 30 new foster homes. That's more than one a day. I mean, that's a really good accomplishment for us as a division. And we did it with our partners.
Right. Keep your questions coming. We're still here taking questions from viewers and about DHS and its array of services. There's lots to talk about. You can call us on the phone at 1-800-662-2386. You can also reach us via email at paffairs@aetn.org. And of course, you can get us on Twitter at ARAsk. I've got a question here for Mark. This is a senior citizen. This person wants to know what I can do as a senior citizen to offset medical expenses not covered by Medicare. I live alone and only have an income of about $750 per month.
We do have some Medicaid programs that are available for some senior citizens who are on Medicare, but may not have enough income to pay for those other expenses. So certainly I would encourage that individual to contact our county office and see what they may be eligible for, because there is some assistance available there to help senior citizens who can't afford either those co-pays or those other expenses they incur that Medicare does not cover.
Okay. Kelley, here's another question from a viewer in Washington County. What are the plans to extend Medicaid in Arkansas for those who are disabled?
Well, Medicaid often covers the disabled already. Right. It depends on obviously what that disability is and maybe what other resources they have. I don't foresee the legislature expanding that any further. Of course, I'll never predict the legislature, and I was part of it, but I will never exactly predict it. I don't know of any plans to expand that any further, but that person might want to do the same thing as Mark just said and check with that county office, because there's probably a program available if they're disabled or have someone that is disabled in their family.
This is a question. This is from Twitter. This person, this is a little vague, but maybe there's some broader aspects of this we can address. Why don't all of our counties follow the same rules? When open to interpretation, people get hurt. Just wondering. I don't know exactly what that could pertain to. Maybe perhaps among your county offices. I would think that you are fairly consistent among the rules and regulations that you have to follow and the processes that you follow. But are there problems there that we're aware of, or is this a piece of reform that is taking place, or is this something else entirely?
Well, and this could also mean the impact of the turnover that we do have, particularly in our administrative and clerical positions. We often have new people that are still learning everything that we do and all the rules, and I think sometimes things could get lost in translation, but as far as applying the policy and the eligibility rules, that policy is very clear, and it's you know, it's really not up to anybody's judgment or a judgment call. It's basically, does this person meet the eligibility criteria? Do we have a category that they fit in? And that's how we make those determinations.
Right. We've got about 4 minutes left, and I just wanted to know, Cindy, if you have any sort of final thoughts about what's on the horizon for DHS. We'll have part 2 of the reorganization coming in the near future. I mean, what are you wanting to accomplish in your time here? What do you want this agency to look like when you walk away, or maybe you stay there forever? But what do you want to see?
It's funny you say that, because we talk a lot about. You know, one of the legislators told me one time, he said he liked me because when he asked me, when I first arrived, he said, what is your vision for DHS? And I said, I don't know. I want to get here and figure it out with the people here, and once I actually understand what's on the ground here. And first and foremost, what we're trying to do is put together, and we have a really strong executive team, management team, and employee structure that can together align around a vision for where we're going. In just this short period of time, we have aligned around the idea that DHS should not be so fragmented, that in our fragmentation, we are hurting our clients, that they are not getting the services they need, that we are, in fact, hurting the taxpayers. We are not maximizing the tax dollars. We are making life difficult for our partners who can't figure out who to deal with, how to deal with someone. So we are trying to first turn ourselves into one agency, DHS, and make it very easy for those outside to work with us. Who do we want to be? We want to be a place where 5 years from now, people who come out of school, we're their first choice of where they want to work. We want to make sure that our employee base is strong. We want to make sure that we want to make a difference in the health of people in Arkansas. I mean, what we've started talking about lately is our goals. Where do we stand nationally? How do we put ourselves on track? We don't want to be competing for where we fit in terms of the bottom 10 or 15. We want to be on a track to be where everybody in the nation is looking and going, why are they first?
Right.
There's a lot of places that Arkansas is innovative and is leading, and we want to bleed that through the whole organization. So we've got some pretty big desires about what we want to do, but it starts with two things: being a team and being focused on those we serve. If we can do those two things, I think we'll transform this whole organization.
All right. Well, thank you to the panel for coming in tonight. We've answered some questions and hopefully shed some light on things, so thank you all for coming in as well. I want to say a special thanks to our phone bank volunteers, the Arkansas State Employees Association and the Friends of AETN. Thank you very much for manning the phones and taking the questions tonight. And also we want to thank the viewers for watching and asking your questions as well. Thanks for joining us. This has been Arkansans Ask, and we'll see you next time.
Celebrate AETN's 50th anniversary.